Welcome. This is Mental Health Matters. There are many misconceptions out there about the causes of psychological problems and mental disorders. Oftentimes, these misconceptions are an important factor that contributes to the stigma of mental problems. In this installment, I will provide some important information about the causes of mental disorders and how we can reduce stigma by better understanding what someone with psychological symptoms is experiencing. There are two main ways people think about psychological problems, and both can be related to increased stigma. One way people tend to think about those who struggle with problems like depression and anxiety is that the symptoms are a reaction to something in their environment and are fully within the control of the person who's experiencing them. People may think that those individuals are just simply not doing enough to take care of and help their own situation. Often, people who are generally mentally healthy expect others to behave the same way they would if they were experiencing feelings like being down or unmotivated. They might say things like, just calm down and pull yourself together, or smile, you'll feel so much better. But when the person who's struggling with those symptoms is not able to help themselves feel better, people may assume that they're just not trying hard enough. Another way people think about these struggles is that the person is mentally ill and has no control at all over their problems. They might assume their struggle is due to a chemical imbalance in the brain, or to genetic factors or other biological factors. This can result in viewing people with mental disorders with pity and sometimes even with fear about their unpredictability or fear that they might be dangerous. People may fear marrying into families with relatives who have mental disorders and may not be sure how to approach a conversation about it. Prevailing theories about the causes of mental disorders and the general consensus of the research in this area is that in order for a clinical disorder to emerge, two basic criteria must be met. The first one is that a person must be biologically predisposed to the disorder. What this means is that we are all different in our psychological makeup, including things such as how intensely or how varied our emotions occur and how we experience them, how nervous we might get in front of certain people or in various situations in regular life, or how trusting or skeptical or paranoid we are in our relationships. The second criterion is that a person must experience some kind of stressor that pushes them beyond their own capacity that they're normally able to deal with. Now, since everyone's capacity is different, it can sometimes be hard to understand why someone is struggling with something that another person may feel is kind of typical. The key thing to remember is that we all have our breaking point. And while mentally healthy people can be quite resilient in the face of pretty significant stress, for some people it takes a lot less to trigger that person to a point of losing control or being unable to manage what they're going through in life at that time. As difficult as it may be to live with or to have a relationship with someone who's struggling with a mental disorder, it is far more difficult to be that person who's struggling. And because we're not always able to see the cause of someone's symptoms or to understand how a seemingly small event created so much dysfunction, it can often be hard to understand how much suffering those symptoms can bring. Thanks again for watching today's installment of Mental Health Matters and for doing your part to fight the stigma of mental health problems. Stay tuned for future installments of Mental Health Matters for accurate and reliable information about a broad range of mental health topics. Your feedback, your questions, and your comments are always welcome, and you can send them to me by visiting drdbrownstein.com, facebook.com/drdbrownstein, or at Dr. D. Brownstein on Twitter. Remember, mental health matters.